Welcome to our Meet the Executive Director session in honor of May VHL Awareness Month. Today, I'm excited to be joined by Dr. Ilene Sussman, Executive Director of the VHL Alliance. Ilene joined the VHL Alliance in the fall of 2011. In her role as Executive Director, Ilene has led VHLA's quest for a cure while continuing to support patient advocacy and education. Ilene has a PhD in biochemistry from the Weizmann Institute of Science in Israel, along with a master's in biochemistry and a bachelor's in biology from the University of Pennsylvania. Ilene has stressed that finding a cure for VHL brings us one step closer to finding a cure for cancer, knowing that the VHL gene is involved in many other forms of cancer. Ilene recently announced that she will be retiring at the end of the year. She will be leaving very large shoes to fill, but I think I speak for everybody when I say how appreciative we are for all of her many years of hard work, support, leadership, and dedication to the VHL community. Ilene, thank you for joining us.
Thanks, Josh. First of all, I do want to say my feet are not that big. They're only 6.5, so I actually have small shoes.
All right, well, let's just jump right into it. Ilene, I can't help but to notice, why is your hair blue?
VHL Awareness Month. Let's go. Everybody turn blue. And actually, we just are doing a campaign. It's not over yet, but we called it Clippers Against Cancer, vhl.org/clippers. And a group of us did some fundraising around men particularly, clipped their hair and shaved it, while some of this women turned blue.
That's great. Looks great on you.
Thanks.
So, Ilene, what led you down the path of an education and a career in the natural sciences and advocacy?
Wow. So the natural sciences is a sort of a long story that I won't get into, but I really enjoyed them. I felt that there was always a question out there. It's like a puzzle. I'm putting puzzles together is one of my things. And so I really enjoyed trying to find answers and studying and continuing to grow. And so that was why I went into science. And then I decided to go into advocacy because as a midlife crisis, I realized, or I felt like I wasn't having as much of a direct impact on patients or on people as I would like. And so I decided that going into advocacy and into the nonprofit sector was a better fit. And I've really enjoyed it. It has been exceptionally fulfilling. And I'm so glad I had that midlife crisis.
And so are so many other people. I know you started working at the VHL Alliance in the fall of 2011, but what sparked your interest specifically in the VHL Alliance?
Yes, that's a really funny and interesting question. So first of all, once I got into the nonprofits, I realized that because of my background, I was best suited for the medical community and the medical world of nonprofits. And in my last position, which was in thrombosis, I had a very, very close colleague and friend whose wife's family had this, what he called then a rare disease, he couldn't even pronounce it, where brain tumors would grow obviously in their brain, and that they would have them removed and they would just wait for the next one to come. And when I saw this position, I realized that this must be it. This was von hippel-lindau, the disease he couldn't even pronounce. And believe it or not, I actually did this as a way of staying in touch with Chuck, which has worked. And that's how I ended up in the VHL world.
What a great story. Well, since then, what has been your most memorable experience working in the VHL world?
Wow, that's another tough question. First of all, dyeing my hair blue, definitely. But seriously, I think it was really on my first day when I answered the phone. Obviously hadn't done very much, basically shown up to work, and I picked up the phone and said, "Hello, VHL Alliance." And the person responded back, "Wow, thank you for all you do for us and to support us." And that really set the stage for the future.
What has been your proudest accomplishment?
Wow. Keep saying wow, because you really got some tough questions. So I think there are a number. One is creating a strong team in the office that can really hit the ground running, is nimble for making changes, as we've experienced during this COVID pandemic, and really wanting to work to improve the lives of others and helping others. I think also engaging new volunteers is really been a remarkable experience and a great help to the organization. And I hope that that continues to grow. Also, obviously, the growth in VHL programming, the support programs, the education programs, and so on. I think that that has been a wonderful accomplishment, as well as increasing involvement, not just through volunteers, but more people engaged in what we do. Can't leave out the growth and improvements in the CCC program. Thank you, Josh, for all that you've done in that. Increase in fundraising. Heidi has done an awful lot to that, and that has also led us to increase the amount of funds that we're using for the competitive research grants to advance the accomplishments in VHL research.
It seems amazing that you've accomplished so much in such a short time, and I know so many people are so appreciative.
Thank you.
Do you have any regrets?
No. I'm also often asked that about leaving science in general. And as I always say, I have never looked back. I have really best midlife crisis one could have.
What has been the biggest challenge that you have faced?
Wow. I think really now is probably one of the largest challenges. Obviously, the situation in the world has changed. We're all working remotely. We've worked really hard, but it certainly has created some extra challenges we weren't expecting or really, in a sense, prepared to deal with. I think we've done an excellent job in gaining ground, actually, and using it to our advantage, making lemonades out of lemons. And obviously, that's something that none of us predicted and could have prepared for.
Now, I know during your tenure at the VHL Alliance, you've put a big focus on VHL research. But why is participating in and contributing to VHL research so important?
Well, so obviously, as a researcher, at heart, I feel it's very important, and it really is the future of VHL. Paying it forward, finding a cure for VHL, finding a cure for cancer, and really thinking not just about this generation, but next generation, and how we've improved lives tremendously since the start of the VHL Alliance, the quality of life, the extension and the longevity. I mean, people are living well into their 60s, 70s, and even 80s, which was never expected. But, the more we do and the more we invest in research, whether that's financially or by volunteering and being in a clinical trial, the more likely we are to be able to find a cure or at least a successful treatment.
And I would just add to that, participating in something like My VHL is also a great way for people to contribute.
Yes, you're right. And I actually want to get into that. I think that that's essential. It is very important at this time, particularly as we see PT2977 or MK6482 move forward and the trial ongoing, and the importance of that background information is essential. And also as we move forward to possibly other drugs or treatments, it's enormously important. And I really encourage everybody to participate. VHL.org/myVHL, call Josh, call the office, email us. We're more than happy to help you in any way and assure you that it is safe, secure. No one is going to get your identified information. No one.
Taking a step back, since you began working in the VHL community, what have been some of the greatest advancements in our understanding about VHL, as well as treatment and surveillance strategies?
Yeah, So despite the COVID pandemic, we really believe that 2020 is the year for VHL. Probably started a little early with the Nobel Prize for HIP and for understanding the tumor suppression gene, which is VHL, as well as the mechanism for identifying the oxygen sensing mechanism in the cell. And so we're really grateful for the researchers who started that and really advanced that research. And obviously that was quite the award for the researchers as well as for us for understanding the involvement of this mechanism in so many other forms of cancer. So very excited about the new surveillance guidelines that we're starting to roll out. That was quite a feat. It was an 18-month effort led by Anthony Daniels at Vanderbilt University, along with about 60 experts from around the world. Probably one of our biggest accomplishments in 18 months sounds like a long time, but it was really not very long. It was also an outcome of one of our symposiums, which shows the importance of these. And we're now in the process of having them endorsed by societies, manuscripts being written up and dissemination to the doctors around the world. And then, of course, the PT2977 or MK6482 trial. We're waiting with bated breath to hear the results of that. We have seen a lot of anecdotal data that looks very promising. We've seen that through Facebook. And we're excited that at the end of the month, it will be discussed at ASCO by Dr. Eric Yonash.
I know that there's so many people waiting on bated breath for that.
Right, but I do want to manage expectations because like we're seeing with a vaccine or treatment for COVID, we also realize how long it takes to get these things going. What we don't know is, first of all, whether the real results will be positive. Then we don't know whether or not what Merck plans to do with the drug, whether they plan to go to the FDA, whether they plan to seek approval, and how they plan to do that, what their timeline might be if they do this. And then ultimately, it depends on the FDA, which is completely out of everybody's control. So we really do, even though it looks good right now on paper, actually it isn't even on paper, it's only on Facebook, we need to realize it could be years for this drug to even possibly be approved if it is going down that route.
Well, I guess that leads into my next question. Where do you think the next big breakthrough in VHL will come from?
Well, certainly I'm very hopeful for MK6482 that Merck will decide to go forward with this and the FDA will approve it. My dream in life is that there might not be another trial, phase 3 trial needed, but again, we do not know that. There could be, and I know that there are thoughts, what would that look like? And then, ultimately, I think that we do need to think about, and this sort of is my dream for 5 to 10 years, but more like the 10-year period, will there be a genetic therapy? And I think that there's so many ifs in that, that it really, again, it is a 10-year plan in a sense. Gene splicing and gene changes in the gene are really still at their infancy. When we talk about VHL, we're talking about a systemic disease, not just the eye, not just the kidney, not just the pancreas or whatever, where we've seen a couple, I think it's about a dozen therapies approved so far, but they're limited. There's a lot we don't know about VHL, so there's a lot of information that needs to fill in the gaps. Why are there, each organ is different. What does that look like? Why are there differences? Are there different cell types? Obviously, there are different cell types involved. That we really need to understand more, as well, again, as understanding to manipulate the genes. And so there's just so much more work. Would it even be a systemic therapy, or would it be something that would have to go organ by organ? So again, this is something that I would see more as a 10-year plan, but to have something in our hands that could actually treat VHL for the time being, it would be also a great dream.
I know you sort of just touched on this, but what do you think the VHL landscape will look like over the course of the next 5 to 10 years?
Again, I just to reiterate, I hope that there will be a systemic therapy. I hope that they can understand how it works, that there, again, is no breakthrough, where the body is very clever and knows how to get around mechanisms and blockages. And that's what happens in the heart when new vessels form, when you have a blocked artery or blocked vessel. And so, I hope that that this gets approved, that they really understand it. And more importantly, why it might work in some organs and not others, as well as in some people and not others. So I hope we also understand the epigenetics, the other factors that are going on with VHL.
That's a great point. Talking about the clinical aspect of VHL, why is coordinated expert care for VHL patients so important?
Well, it's essential. First of all, as we all know, there are about 7,000 rare diseases. It's impossible for any one person to know everything about them. So you really want somebody who understands VHL and understands the nuances of treating VHL, whether that's the removal versus the watching, the wait and see. You don't want to take the tumor out too early, but you don't want to take it out too late. But, if everyone goes into your kidney, every time you have a small little tumor, you are going to lose your kidney function. The same thing, going into the brain or the spine or wherever. So it's really important for people to understand the surgical approaches, to understand the removal approaches, when to remove, the impact a theo might have on the hormonal body. It's more of an art than a science, like many other diseases. And so somebody with all that experience and that knowledge is very important. You also have to make sure, I think, the coordinated care, and just even being at a clinical care center, obviously with coordinated care, is so essential, because you need so many different specialties, and you want to make sure that whoever that quarterback is communicating with all the other specialties and making sure that your body is scanned and not just your eye, not just your kidney. And also you want to make sure that there's communication. What if you have two simultaneous manifestations? Which one's more important to remove? Which one do you do first? Or if you go in for kidney surgery, you want to make sure you don't have a theo. And so the only way to really guarantee that you're going to have experts in all those specialties and knowledgeable doctors is through a clinical care center. So that to me is essential.
What advice do you have for newly diagnosed VHL patients?
So obviously, I think that's up to each individual, how they want to deal with it, what they want to do with it. But if it was for me, I think really education, knowledge. It's powerful. I would really strongly suggest they go work with a clinical care center. They get involved and connected to the VHL Alliance, where it's a tremendous support community. I mean, Facebook is incredible. The closed Facebook group, and meeting people with VHL is essential, like through the annual meetings, the young adult retreat that's coming up. That one-on-one communication it's amazing, the support and friendship, lifelong friendship you can find through this community. So I would recommend some of the support programs, again, Facebook, some of the monthly telephone conversations, and the live programs. You can learn more about those by going on to vhl.org/support, or calling one of us, emailing one of us. We're always here to help in any way that we can.
It really is an amazing community.
I've learned so much from this community. It's just incredible.
So Eileen, what other passions or hobbies do you have outside of the VHL community?
Besides dyeing my hair blue occasionally. Anyone who knows me knows I love fiber arts. If it's knitting, weaving, sewing, anything with thread, yarn, or a needle, I'm in it to it. Full way. Love doing that.
What's a fun fact about you that most people don't know?
I shot in the dark because I grew up near 3 Mile Island, which was a nuclear plant. I don't know how many people really know this story. It was a nuclear plant in central Pennsylvania and had one of the first leaks. So I glow in the dark.
I'm sure your husband appreciates that.
Actually, he's the one who told me to use that.
Eileen, what do you want your legacy in the VHL community to be? How do you want to be remembered?
So I honestly don't see it as a legacy, to be honest. I see myself having had the honor to work for the VHL Alliance and for the VHL community. Each person I've met has changed me as a person, and I see that as being what I have gained through this position and through this opportunity. I've really learned to look at life half full as opposed to half empty. And really, I want to thank the VHLA for hiring me and the constituency for allowing me to be part of your world.
And what are your plans for retirement?
Well, it was supposed to be travel. So we'll see how that goes, considering where we are today. Not sure I want to get on a plane so fast, nor do I want to stand in the lines for a plane. I definitely plan to do more sleeping, more time for myself, spending some time with my family and my daughters, and having time to do the hobbies that I love, to learn other things, and just simply to enjoy and relax.
Now, we do have a question here from the live audience.
Okay.
Are the preventative screenings for new tumors for VHL being performed during the pandemic, or should somebody with VHL delay surveillance until after the pandemic calms down?
So I totally think that's up between the patient and the healthcare professionals. It depends on each individual situation. It's not for us to say one way or the other. The clinical care centers have been informed of the new guidelines, but it really is up to each patient to discuss the importance of it with their team, their healthcare team.
We have one more question for you, Eileen. Can you speak to the prevalence and penetration of VHL throughout the world, and if there's any difference between geographic location or race and ethnicity or anything like that?
Yeah. So the answer is no, there are no differences. We have never really studied, some of the smaller countries, but there is no reason to believe that there's a difference in geography. I think in some countries you might not know it because it might not be as diagnosed as it could be. I'm not sure we've really fully reached our maximum in diagnosis anywhere in the world. It's sort of like COVID. There's no reason to believe that. There is no difference between backgrounds, ethnicity, gender, nothing that has ever been detected.
Eileen, I just want to thank you again for taking the time to talk to us today and for your many years of service to the VHL community. There's no way that we would have come as far as we have in such a short period of time without your leadership. And everybody wishes you nothing but the best in retirement.
Thank you, but I'm not going anywhere till after December, so you're stuck with me till then.
Good. For everybody watching, I invite you to join us for more May VHL Awareness Month events. You can find the calendar with all of the events at vhl.org/May Awareness. Until next time, stay safe.